Welcome, everyone. We are going to get started for our DNP program, and we're going to start. Um, all right. So we today want to make sure that we answer all their questions that you have. We have a lot of information to send to you today. So we're excited that you are here with us. All right, so we're just going to get going and we're going to let you know that we are recording this event. We like to put this on our YouTube channel for the college. You are in listen only mode today. You will have time to submit questions in the chat, and we will answer them towards the end of the presentation. All right, so we're going to introduce you to our team today. Jane, would you like to start?
Sure. Hi, thanks for joining us. I'm Jane Herman. I am the Recruitment and Admissions Coordinator. I work specifically with our graduate and online students. So if we have not already met, I look forward to working with you.
All right, thank you. And Gina, would you like to introduce yourself?
Yeah, sure. Hi, everyone. My name is Dr. Gina Crudden. I am an assistant professor in the DNP program across all tracks, and I'm also the adult gerontology core coordinator for curriculum.
Great, thank you. All right, Tara, would you like to introduce yourself?
Hello, my name is Tara Whitmire. I am the director of the DNP program here at Nebraska Methodist College. It's very good to have you on with us.
All right, thank you all. All right, Jane, you want to jump in?
Yep, I'll just give you guys all a little information about the college just to kick things off. We do have over 40 areas of study here at the college. So sometimes people don't know, all the varieties of things that we offer, but from certificate through our doctoral programs, and then also continuing ed opportunities after that. So many areas you can get involved in here. We have been around for 133 years, so we like to say we have gotten very good at what we do. So we're pretty proud of that. We have students in our doctoral program, especially from all over the country. So in our online programs, we have people here from over 33 states, which we think really offers a rich experience for you all. You get to collaborate with people from all over, which is great. We do offer some upfront pricing information. So we'll get into that later in the presentation, but no hidden fees and things like that. We do have a nice, clean picture of what all of the costs will be for you, which I think is very helpful in your planning. One nice thing about Nebraska Methodist College is that we do have about 100 community partnerships. What that means for you is great access to clinical sites and preceptors and things like that. We are associated with the Methodist Health System, which if you are local, that is really going to be a benefit to you as you move through this program. Something else that we're very proud of here is that 100% of our faculty are leaders in their field. So many of them, including everyone on this call, is still involved in the hospital outside of the college. And so they have boots on the ground as well and can really be great resources for you. And they know exactly what you're experiencing. I'll pass this off to, I think, Dr. Whitmire or.
Yeah, I'll take this one. So a little bit just a highlight overview of our program. We do have multiple tracks within the DNP program. We have the 3 advanced practice role tracks and then 2 that are masters to DNP prepared. And we'll get into those in just a little bit. All of our faculty are engaged in practice, as Jane just mentioned. I am a nurse practitioner. We have Dr. Crudden is a clinical nurse specialist. We have another nurse practitioner on faculty. So we are still engaged in practice and are staying up to date on evidence-based practice and guidelines and really are able to bring that knowledge into the classroom and help prepare you to be an advanced practice nurse who can think outside of the box with your doctoral degree. We do have full and part-time plans of study, and also new for this spring admission, we are offering spring admission. So we previously only offered admission into the fall, but now are offering spring enrollment, and that will allow you to get a few classes out of the way initially, and then roll in with the fall cohort and still complete the program in either 3.5 or 4.5 years, in addition to the fall starts that are 3, 4, or 5 years. Our online format allows for a lot of flexibility. You're mostly doing your work asynchronously, meaning on your own time. We'll get into a little bit more about synchronous class times, but we open the course at the beginning of the semester. You're able to see the whole thing. You can work ahead if you want, but we really do provide flexibility in that we're not telling you everything that you need to do. You can work on your own. Our due dates are pretty standardized. Things are due usually on Thursday or Saturday. Sunday kind of gives you a day to rest, and then the next week starts on Monday. So we think that works out pretty well. And we do require that students come to campus. So we probably are more of a hybrid program than a true online program, but this participation in these on-campus intensives really allows you to practice new skills. It allows you to reconnect with your classmates and your faculty and have that sense of belonging and community. And we just love to make you come to Omaha at crazy times of the year to experience our weather with us. So a little bit about our MSN to DNP tracks. So these are for nurses who already have a master's degree and who are looking for the terminal degree or to learn a new role. So our APRN to DNP track is for those that are already practicing advanced practice nurses, either nurse practitioner, clinical nurse specialist, nurse anesthetist, or a certified nurse midwife. You have a master's degree and now you want to get the DNP degree. So this is done in about a 2-year time frame. You're really getting the leadership and finance and kind of systems level courses, as well as doing a doctoral scholarly project, which is a translational research project that we'll talk about a little bit later, but just getting that information that's going to take you to the next level and help you be a leader as well as be a better problem solver. Our public health policy track is for that nurse that has a master's in nursing or a master's in public health. And this person is really interested in public health, community health, advancing public health policy, really making an impact on community health as a whole. And there is clinical time associated with that. You also do a doctoral scholarly project. But this just lets you kind of take a deep dive into policy and the impact that has on the health of a person and the community.
Yes, and for those with a BSN, so those are nurses with a bachelor degree with a license as a registered nurse, the track options that you have are going to be the following. So for those interested in the family nurse practitioner track, the key role for this track is, you're going to be caring for patients across the lifespan. That could be from the pediatric patient all the way up to a geriatric patient. The focus on this role is primary care in an outpatient setting, and this includes health promotion, disease prevention, and managing chronic illnesses. Some of the major skills you'll be taught throughout this track is comprehensive health assessments for all age groups. You'll learn how to develop and implement care plans for patients at various life stages, prescribe medications and order diagnostic testing, collaborate with other healthcare professionals and providers to ensure continuity of care, and family-centered care focusing on preventative strategies. For the adult gerontology primary care nurse practitioner role, you're also going to provide care for adolescents, but that would be to the older adult rather than pediatrics. The focus here is on chronic disease management and health promotion in outpatient settings, and there is an expertise in the aging process and related health needs. needs. Some of the major skills, again, with this track is going to be the diagnosing and managing common adult health conditions, managing complex chronic conditions, in this case, diabetes, hypertension, and heart disease, patient education on disease prevention and health maintenance, and collaborating again with your multidisciplinary team for the management of the older adult. For the adult gerontology clinical nurse specialist track, the key role for this is the focus on the care of adolescents to older adults at an outpatient or systems level. This is also to improve healthcare outcomes through evidence-based practice, system changes, and direct patient care. And you're in this role, you would act as a leader in a healthcare system to optimize care delivery. Some of the major skills taught here again is also going to be for that system level analysis and implementation of evidence-based practice, expertise in managing care for the complex adult patient within a healthcare system, consulting with healthcare teams, and developing and leading quality improvement initiatives. You can also function as a mentor and an educator for nurses and other healthcare professionals in this role, and function in direct care role with patients impacting their health outcomes. As far as the program format for our courses, they're usually 5, 10, or 15 weeks with a scheduled break every 5 weeks. You do have the opportunity for collaborative interdisciplinary learning opportunities. This can be from several sources, including subject matter expert lectures with pre-recordings. We could also talk about the technology support. With synchronous learning opportunities, that's when we would get together as a class and have class with each other, and that would be at least a minimum of once a semester. As Dr. Whitmire said, the asynchronous learning opportunities would be when you're reading and looking at your resources for the course on your own, but that just gives us the time to connect. There are some times also in the program that we'll be together for NRS 700. That's your orientation, where we'll have you come to campus for that on-campus intensive for the weekend when you first start the program. For nursing 706, that's advanced physical health assessment. That's also the on-campus intensive, and that's for the BSN DNP students only. That would be also a weekend the first year that you're within the program. Population health is that NRS 832. That's also an on-campus intensive, usually within the second year of the program.
A little bit about practicum. So all the BSN to DNP tracks require 1,080 clinical hours, and each track has a prescribed plan of study that's related to those hours. Most of your time is going to be spent in a primary care setting, such as family practice, internal medicine, and urgent care, where you're really going to get the opportunity to care for people with acute problems like the flu or ear infections, strep throat, all those things that kind of seasonally happen, but then can happen at other times of the year, maybe injuries and those sorts of things, but then also the opportunity to care for people with chronic disease like high blood pressure and high cholesterol and COPD. So really getting a broad experience caring for adults. You also have the opportunity to care for pediatric patients and spend time with a pediatrician or a family practice provider that sees kids, and really be able to do the anticipatory guidance, like, all right, they're getting to be this old, what should we be expecting from their developmental stages, and what kinds of things do we need to educate parents on, and just keeping that population healthy as well as opportunity for women's health rotation. And this is all in the family nurse practitioner realm, but taking care of a pregnant lady, taking care of somebody in perimenopause, just, taking care of a woman in all stages of her life. And conversely, in the adult gero populations, you'd be seeing people from adolescent to adult, as we talked about. So again, maybe caring for women, and kind of understanding what the teenage years brings, and the early adolescent, knowing what to expect and to educate for them. We do allow you to do some specialty rotation. So in Practicum 4, when you're getting near the end of the program, you are able to go and do some inpatient rotations. Pretty much wherever a nurse practitioner practices is where you're able to go. And the purpose of those hours is to help you identify kind of how that knowledge or that specialty's expertise can be applied to your practice in primary care. So we are training you to be primary care providers working in an outpatient setting. We don't have an acute care track where you would learn to do more inpatient critical care sort of work. But we do give you the opportunity to learn from those people in order to be a better primary care provider. Students are asked to identify preceptors. We do work with you to match you up with people if needed. We have a bigger network across the country, as Jane alluded to earlier. We have had students on both coasts and in the South. And so we are making more contacts with clinical facilities so that you are able to go do your clinical hours there. And you and your faculty work together to identify appropriate places, appropriate preceptors, and then meet several times throughout the semester to check in and make sure you're getting what you need from that experience. So in total, you're doing about 960 direct patient care hours, and then 120 hours are devoted to your doctoral scholarly project implementation. For the APRN to DNP track, we are crediting you 500 hours from your MSN degree, knowing that you needed that minimum amount in order to get to graduate and certify and license as an advanced practice registered nurse. And so we're then asking you to complete 540 hours related to your doctoral scholarly project. So this is a multi-course process. We walk you through the entire process, but you're getting clinical hours for that work for that APRN to DNP kind of terminal degree track, so that you can have over 1,000 hours when you graduate, as that is the current minimum. And then for the public health policy track, we're giving you credit for 100 hours that you probably got in your master's degree, whichever track you did for that, if it was nurse exec or educator or whatever track that was for, we're giving you credit for 100 hours. So you're also completing 960 practicum hours through different clinical experiences and your doctoral scholarly project. So you aren't going to be doing face-to-face clinical or direct patient care as the BSN to DNP track students are. You're focusing more on sort of population health initiatives, spending time with community health leaders or state senators or other agencies where public health happens. And so those are prescribed throughout the program as well. And you and the faculty work on what those hours look like or what kind of project you're working on related to those hours. And then again, the time for your doctoral scholarly project counts as well.
Okay, thanks. I will talk a little bit about the admissions criteria. So for the BSN to DNP, you need to have your BSN, of course, or a master's degree, and from an accredited institution. We don't have any prerequisite coursework. So really what I need from you is your bachelor's level transcripts or master's level if you have that. We need to ensure that you have an unencumbered RN license in place. So we'll be looking for that. And then typically we're asking for a GPA of 3.0 or higher. We will review people who maybe fall a little below that 3.0 on an individual basis. So if that's you, don't be discouraged from applying. We can chat through that and still review you for admission. And then there is a section that you'll complete called Fulfillment of Technical Standards. That's just answering some basic questions about if you are able to complete the tasks that were required as far as lifting and being on your feet and things like that. And then we do also need to make sure that we meet state authorization guidelines if you live outside of Nebraska. And so that is because for an online program, there's oftentimes just restrictions and guidelines we have to follow. So if you do not live in Nebraska, usually I see that fairly early in your process of looking and visiting with me. So I always make sure that we check out where you live and make sure that that we are able to provide education for you there. And then for APRN to DNP, we just need your master's degree transcripts to ensure that you have that master's degree from an accredited program. a license as an advanced practice nurse that is current, and then kind of the same from there. We're looking for the 3.0 GPA, unencumbered license, and then the fulfillment of technical standards and state authorization guidelines must be met for this program as well. And then for the public health policy program, you just need to have the BSN from an accredited institution, or you can have a master's degree in nursing or public health. So whatever your highest degree is, that's of course what we need to have information about. 3.0 GPA or higher, and then an unencumbered registered license. If that's what your degree is in. Practice as an RN for all of these is not required, just so that's clear. It's recommended, but definitely not required. So if you are a new grad for the BSN program, BSN to DNP program, that's completely fine as well. And then we also need to just have that technical standards filled out and make sure that, again, you meet state authorization guidelines. So for the application, it's honestly pretty quick and painless. So for the BSN to DNP, we actually take those applications through Nursing Cast. If you're not familiar with that, it's a common application site where we collect all the application material. That way, if you happen to be applying to more than one school, you only have to request those transcripts and things one time. So it's just a nice place to house the application. You will be asked to upload a copy of your current resume or CV, and then there is an application essay. My advice here is make sure you refer to the writing prompts that are given and address those prompts in your essay. Sometimes we get more of a personal statement, and that's not really what we're looking for. We really do want you to address the prompts that we give you. And then you will request your official transcripts, and you'll have those sent directly to Nursing Cast, and those will be added to your application there. So you don't send them to Nebraska Methodist, send them to Nursing Cast. And then we review your application. If you are qualified for an interview, you'll be invited to do so. The interview is held, we do those over the phone. 2 faculty members will be on the call. You call into a phone number here at the college and do a phone interview with 2 faculty members. We have a very standard set of questions that we ask, and then you'll get to spend some time with faculty learning more about coursework and clinicals, kind of details we're actually touching on today. So watching this is very helpful. And then you will have plenty of time to engage with them and ask them questions too. So we want that interview to be personal and helpful for you. And then for the APRN to DNP and the public health policy, the application is pretty much the same. However, those applications actually do go through our website. So otherwise, it's very similar to the BSN to DNP, but we do take those applications through our website instead of through Nursing Cast. When you do apply, regardless what program you're applying to, if you go to our website and click the button that says apply now, you will be routed to the appropriate place. So you don't have to find Nursing Cast on your own. It will lead you there if need be. And then just a little deadline information for you. So as Dr. Whitmire mentioned, we do have a spring start for the first time for our BSN to DNP, but for all tracks, that spring deadline is December 6th. I don't really recommend waiting until December 6th to get your application in. As we all know, December gets a little crazy with Christmas and vacations and all things holiday. So I really would love to see your applications come in by the 1st of November. We want it to be a good experience for you. The longer you push it to the deadline, the more rushed things feel, and we just want you to get started on the right foot. So I would just make November 1st your goal for the application for spring. Although we are conducting interviews and accepting students currently. So the sooner you apply, the sooner you know. So then for fall, the application deadline, we just kind of set a few different ones to give you kind of standards to fall in place. For the priority deadline, it's January 31st. What that does is just kind of get you in on that first round of interviews. So you're going to have many more dates and times to choose from the earlier you apply. So just try to meet those early deadlines. Again, try not to push it to this July 11th deadline because, again, summer's busy and crazy with vacations and family things. So if you could apply in May or June, that would just really set you up for success and give you plenty of time to kind of get all the onboarding things done that you need to without feeling too rushed. In both of these instances, we do accept on a rolling basis. So once you've applied, if you're invited for an interview and you have that interview, you're usually hearing back from us within a week, maybe a little longer when it gets busy with applications, but within a week, 2 weeks tops. I don't know that it's ever taken that long. So we really like you to get an answer back quickly so that you can start making plans for your future and what you're gonna how you're going to make everything fit into your schedule in your life. So the sooner you apply, the sooner everything happens. But we really like to try to get back to you within a week. So I think that's pretty unique for us. And then here's just, again, the timeline. So if you are, this is just giving you kind of a reiteration of if you do want to apply for spring, just a mental note is that classes do start January 13th. So that's the timeline you're looking for. So as I said, applying by early November would be your best bet. With that July 13th start date, you can kind of plan that your days on campus for that in-person orientation would be the 11th and 12th of January. We usually do a social event, kind of a get to know you on the 10th, and then those mandatory days on campus would be the 11th and 12th. So same for then the fall start, your days on campus would be the 16th and 17th. So nice to plan ahead and kind of block those days now because those are your required days on campus. And then just a little bit about cost. As I said, everything's pretty upfront and easy to follow. Tuition for the 24-25 school year is $8.50 per credit hour. I get asked often if we have an in-state and out-of-state difference. We do not. This is what everyone pays. So this is the tuition. There is a $150 enrollment fee, deposit fee. So when you are accepted, you'll be asked to submit that deposit. It does get credited towards your account, so it's not money lost. But what that does is hold your seat in the program and just kind of lets other departments know that you're planning to join us. It just kind of triggers things to start happening as far as like getting registered for classes, meeting with your advisor, and things like that. So that saves your seat and just kind of gets the ball rolling in the other departments. And then I've kind of listed out here some fees. Technology fee is kind of the main fee that we charge, and that is a fall and spring fee of $500 and then a summer fee of $250. Most of the rest of the fees are all a one-time fee with the exception of that up-to-date clinical software that the BSN to DNP students use, and that is billed 3 times throughout your time here. And then for financial aid, our graduate students do have a dedicated financial aid counselor. So you have one person to go to in the financial aid office who is very familiar with working with graduate students. So that's a great benefit for you. The FAFSA code is on this screen. So if you want to save that, that's the code that you'll use when you submit your FAFSA. I have not heard the new FAFSA for 2024, 2025 is supposed to open in October. I don't know if any of you are aware, but last year the FAFSA was kind of a mess because the government kind of redid it all. So it didn't open when it was supposed to and things like that. So just, check in and maybe just be prepared for that as they kind of iron out their changes. If you're starting in the spring, you can fill out that FAFSA right now, and then you would do the 24-25 school year for the fall semester. So if you're a spring start, you do it now and then again for fall. We do have a few things available to students. If you happen to be a returning student, we get lots of graduates, NMC graduates who come back to us, which we love. If you are a returning student, you are eligible for a one-time award of $2,000. You're also eligible for that if you have a parent or sibling who came to Nebraska Methodist College as well. Definitely research your tuition assistance opportunities with your employer. just within the community, within any organizations that you belong to. There's money available for scholarships and grants. You might have to do your homework a little bit, but I've been told that National Nurse Association organizations, local, state organizations oftentimes have money for graduate students. So make sure you look into that, and definitely check with your employer to see what kind of benefits or tuition assistance they offer. There's money out there, but do some homework to find it. We do offer now something that we're really proud of. We have a corporate sponsorship that we offer 20% discount to our health system employees, and with a couple other organizations in the Omaha area. So you can definitely find more information about that on our website in the tuition and financial aid tab of the website. So those discounts are also extended to employees, spouses, and eligible children, dependent children, basically. So, if you have a spouse or a child who's interested and you work at the health system, Children's is another one that we sponsor. So just double check our website to see if where you work happens to be part of that partnership with us. And then we do have some commonly asked questions. We'll kind of go through these. These are things that we get asked a lot from interested students. This would be a great time too. If you have any questions you're thinking of, please use the chat box and start typing those in. And then we'll kind of go over this list first, and then we'll get to any questions that you all have as well. So the first one says, I'm working full time. Can I complete a program like this?
I can take this one, and the answer is yes. We have several different plans of study. As I kind of mentioned earlier, if you're looking to start in the spring for the BS Ed to DNP track, we do have a 3.5-year or a 4.5-year plan of study. And as I mentioned, you'll take a couple classes in the spring and summer semester, and then roll into the fall semester with the incoming fall class at that time. If you're looking for fall admission, we have a 3-year, a couple different 4-year plans, and a 5-year plan for the BSN to DNP. And then for the APRN and PHP, we do have a part-time and full-time track for those as well. It is possible to work full-time and do this program full-time, although I would recommend that you kind of evaluate all that you have on your plate and take off things that you don't necessarily need to do right at the moment, or say no to things. That can be hard, as I am a true testament to that, because I always have too much going on. But this is a doctoral program, and you're learning a brand new role. You're learning how to be a provider. You're going from the bedside to the head of the bed. You're the one that has to make the decisions and put in the right orders and get the right tests and prescribe the right medication. So it really does take more time, thinking time, even not just time to do your homework, but time to process everything and kind of get it all in your brain and understand how you can use it all. So getting things off your plate, finding somebody to clean your house or tote your kids around or something, that all is very helpful so that you have the time you need to do this well and be successful in it. But we do have lots of different options for you. And I always say that nobody ever asks you how quickly you got it done. They just want to know that you did it and you graduated, you passed your certification exam, and you got your license or you got your degree, and now you're ready for the next step. So it's okay if it takes longer than expected. It is possible to slow down in the program. So if you start full-time, it is possible to slow down and drop into one of those other plans. However, you can't really go the opposite. You can't really speed up. Our courses are only offered one time a year, and it would require you to have way more credits than we think is doable. And so speeding up isn't a very good option, but slowing down definitely is. I've had students that start the program off in the 5-year track because that's what's going to work for them, and they are just as successful as the people that do the 3-year track, because they just are. And so it's totally up to you. We don't sway you one way or another. We just tell you to evaluate what you have going on and make the decision for you. And You will be talking with Katie Mintz, our advisor, as you come into the program, and she'll kind of ask you those things too, like, what are all your responsibilities, or who else do you need to take care of? And that can kind of help guide you to which plan of study, which time frame is best for you.
I think a good thing to point out at this point as well is if you visit our website, if you are on one of your specific pages, whether it's family nurse practitioner, adult juror, whichever page you're interested in, if you scroll, it's almost all the way to the bottom of the page, you'll see a big purple box. I think it says meet the faculty. Right below that box, you'll find some additional information about the program. You can actually click on example plans of study. And so you can take a look at exactly what each plan looks like and how many classes and which classes you'd be taking each semester. I feel like that's a really great visual that kind of gives people maybe a little ease of mind when they see how it can be laid out and how many classes they'd be expected to take each semester in one track versus the other. I think that's helpful when you're trying to decide what might be right for you. So take a look at those example plans of study for each of the different programs, and then they're on there also for each of the different start dates. So I think that is a really great tool to use when making your decisions. Okay, the next question is, do I need experience as an RN prior to starting one of these tracks?
That's another good question. And we have taken the stance here at Nebraska Methodist College that we do not require that you have a certain number of practice hours as an RN before starting our program. We actually did a little research study with our students and looked back at data about kind of their critical thinking skills when they entered into their first practicum course. And we found that it mattered more where they worked as an RN rather than how long they worked. So those that were in the inpatient setting or in a critical care setting where you use critical thinking and are really thinking outside of the box and doing different things performed better in certain aspects of their clinical evaluation than those that maybe worked in an outpatient setting or in a long-term care setting or different settings. So not to disparage any of them, but that's just what we found, is that where you worked mattered more than how long you worked. And so we have not taken the stance that you need to work for 2,000 hours before you start the clinical rotations or things like that. Our program is designed like this from the very beginning, that we, very much give you all the critical courses, the patho, the pharm, the physical assessment, that all comes first. So we're really getting you into that mindset of a provider and giving you some practice time to put those things into place and then start into your first clinical rotation, where we don't expect that you know everything. You're learning it. And so you're shadowing a little bit, you're trying to figure it all out. And then you start kind of getting your feet wet of, being the provider, going in, talking to the patient, doing their physical exam, and starting to put all the pieces together. We also find that because we have 960 direct patient care hours, when students are kind of into that practicum 3 and they're starting their last year, their preceptors really say that they're standing out. They feel like they'd be ready to graduate and go start practicing. And I'm always like, that's really great to hear, but they still have 2 more semesters left. And so we really prepare you, we give you the time to be well prepared so that when you do graduate, you pass your exam, you get your license, you're ready to go practice and make those hard decisions and take good care of patients and be a change agent and a critical thinker and all those things. So you'll be ready when the time comes to go out and practice.
Can you talk a little about this doctoral scholarly project?
Sure, I'll take this one, Jane. For the doctoral scholarly project, that is a translational research project that we do have over 4 semesters, typically in the last year of your program. So no matter if you start with the spring start date or if you start in the fall, it's generally the last 4 semesters right before graduation. And typically the first semester is doctoral scholarly project 1, where you're going to do your literature review, kind of develop what is your formerly known as your PICO question, your purpose statement, department, what type of clinical inquiry you'd like to do. We do have you perform a literature search, do a lit table, look at the available knowledge in your area, and that's only a 5-week course. And then in the second semester of Doctoral Scholarly Project, that is where we will actually put a proposal together, where you're going to write what you would like to do. And that goes to our review committee, and then also the institutional review board here at the college, where they will determine whether or not your project is considered quality improvement, evidence-based practice related, or if it is original research. They'll make that determination in the fall in that 5-week course, or 15-week course, excuse me. And then in Doctoral Scholarly Project 3, that's where you're going to actually implement your project. So we're just asking you to do a small test of change or a change project over 30 to 60 days of time frame, where you're going to actually collect your data, analyze your data, and then actually in Doctoral Scholarly Project 4, which is in the summer before graduation, that 10-week course, you'll write up your final report. Along the way, you'll be assigned to your faculty. Usually it's about 4 students to 1 ratio, possibly 5. So you're working really close with them. And then you'll also be working with a clinical partner, whether that's at your hospital that you currently work at, or potentially a preceptor clinical site advisor at the place you're doing clinicals at. I just wanted to talk about a little bit briefly too. At the bottom, we talk about a little bit of a support services, but in regards to the Doctoral Scholarly Project, you're going to have a lot of support. Many of you may have been out of school for a while, so I just kind of wanted to ease your fears that with the Scholarly Project, we do have a lot of scholarly writing. We do offer a writing coach. We do also offer APA 7th edition support from our librarian services, and we also have a statistician on staff to assist our doctoral program candidates with their projects. That all said, I don't want you to stress. This is not a dissertation for a PhD. You will not have to defend your thesis. As far as requirements for graduation, typically we require dissemination to be in the form of a poster or potentially a podium presentation, and this can be done however you prefer. We do also have Nebraska Methodist College offers a research day with many of our students presenting at that time.
Awesome, thank you. What are you guys looking for when it comes to the application essay?
Oh, absolutely. So as Jane mentioned, please pay attention to those written statement prompts. What we are looking for is that you respond to them in entirety. We also would like you to make sure that you are using some sort of APA formatting. We like to use 7th edition. So kind of checking your grammar. There is opportunity to cite a source if you prefer, especially if you're talking about your career aspirations, what you expect to derive from a DNP degree, and any type of impact that you would have as a DNP in the community and in the United States. So typically, if it's a student style paper, you don't have to do a professional paper, but we are asking to check grammar, APA formatting, and just making sure you hit all the highlights of the prompts.
They're all going to be great written statements coming in from now on, I can tell.
Yes.
Now, what happens if I move to a different state?
I can answer that one. So it's very important if you're in the BSN to DNP tracks that you have a license in the state that you are living. You are not required to come to Nebraska to do your clinical hours. You do them where you live. And so we really recommend that you stay within the RN compact states where your license works in all those other states, just because it's easier for you. You don't have to get a new license. It's easier for faculty. We have to be licensed where you're at as well. But also, if you are planning a move, we need to know, because sometimes there are some states we aren't able to offer distance education to. So there are SARAs, it's called SARA. So we need to make sure that everything is going to be okay for wherever you're planning to move to. So if that is something that is on your horizon, we have information on our website that you can click to find out, if we have approval to be in that state, either from the State Board of Nursing or from a SARA perspective. And it's just important that you keep your information that you have with the college up to date as well. I've had a couple people that have moved and And I say something to them and they're like, well, no, I live in this state now. And I was like, well, your address still says you live in Nebraska. So you need to tell us when things like that happen. Not because we're nosy, but because it has implications for your education. And it's just important for us to know so that we can make sure we're following all the rules and are where we need to be.
Will we take transfer credits?
Yes, we do take transfer credit. So it's based on a percentage of the total credits that you're earning in the program. So for instance, in the BSN to DNP tracks, we can transfer in 18 credits. In the APRN track, it's 9 credits, and the public health policy track, it's 12 credits. So there is a transfer credit process once you're accepted and deposit. Katie, our advisor, will let you know about that. If you have courses that you want to have be considered, you need the syllabus from that class as well as your transcript. And there's a time frame. I think we allow like a 5-year cutoff for like the advanced pharmacology and advanced pathophysiology, those sorts of things. Some courses maybe 10 years, but definitely there's a process, and we do accept credit, which can ease your schedule a little bit if you have taken some classes somewhere else and then don't have to take them with us.
How much time do I need to commit each week to the program?
I can take this one, Jane. So typically we refer to the Carnegie credit as our former measurement of how much time to commit. On average, if you are taking a 3-hour course, just a reminder, it is a graduate course, so it's a little bit different than your BSN. I always let my students know, plan for 3 hours for every hour of credit that you have a class, typically anywhere from having 2 courses to 3 courses a semester would end up being anywhere between, I have some students 9 hours a week is about normal up into 20 hours a week, depending on the resources, the reading, and what is needed for the assignment. As Dr. Whitmire mentioned, we do have discussion questions throughout those sessions, and we do have hard deadlines for that. So typically your initial post will be due Thursday evening by midnight Central Standard Time, with a response to your peers by Saturday. Also midnight at Central Standard Time. So if you need to review all the readings and make sure that you've watched all the videos, if there are some pre-recorded webinars, having had said that, that would need to be done before as prep work before those posts can be made. So just think about your work-life balance and how much time you think it would take you to review all those items. So it's anywhere between 9, like I said, to 20 hours a week, depending on the content taught at that particular semester.
I think we kind of answered the next one, is how long will it take to complete the program? So between 3 years and 5 years for DNP, 2 years for the others. So it varies. And I do encourage you to go look at those example plans of study to kind of help you see how those are mapped out. And then we talked a little bit about support services, but are there other ones we need to touch on as well?
Yes, I think we didn't mention that we did have counseling services available even to our online students. We do have telehealth appointments available through a new app called You Will. That is offered to every student, no matter if you're enrolled at the BSN or graduate level. We also, for those locally in town in Nebraska, we have our college campus. Please come and see us. We do have a wonderful study lounge set up for you guys. We also have a wonderful food pantry with no questions asked if you need that service as well. And then our wonderful advisors and everyone is on site. So if you do need support that way, you can certainly come and see Jane, Dr. Whitmire, Dr. Heiser, myself. We're available to you not only through Teams and a phone call.
Great. Did we have any other questions from anyone? If you do, this would be a great time to send them through. Otherwise, for me, your next steps would be, if you have not already applied, to start your application. You can always reach out to me if you have questions. If you think of things later today or next week that you're wondering about after listening to this, you're definitely welcome to reach out. I'm always happy to connect you with somebody else too, if need be. So reach out to me anytime. My contact information is on the screen, and you've probably gotten several emails reminding you about today. So all of my contact information is in that email as well. But you're welcome to come in and see me, or we can do a video chat or through Teams or chat through email or the phone, whatever works for you. But we would love to see you apply for spring or fall and get started with us. I don't see any questions. So if there aren't any, we'll wrap it up for today. And we appreciate you taking your lunch hour to join us, and hope you have a great afternoon.